I don't think about it now. I disconnect from my body. I don't think, this is the body I live in, how will I put up with it? I just cover my ears and close my eyes until I get there, and then I'll see. If this doesn't work, nothing will. I'll try this, and if this doesn't work, then nothing works for me. I may as well just die. In tonight's program, we step into a minefield. When we investigated the care of transgender people, many reacted harshly and with anger. Others said we had uncovered a major medical scandal. As we continue our investigation, we take a look at a key claim: that young people need fast, irreversible help through sex reassignment surgery, or they will take their own lives. This is the core of a controversial bill: to allow 15-year-olds to have such an operation without parental permission, to save their lives. But is the claim true? Transgender people have more mental health issues than others, and the younger ones have the most. But we mustn't take it too lightly, because it's irreversible. This child, this young person, may not even survive. Suicide is overrepresented in this target group. I've talked to some people, and not others, about how I've been questioning my gender identity for some time. Among young transgender people, 40% have attempted suicide. 40%. It's almost unbelievable. If so many people in a vulnerable group attempt suicide, how should society act? What measures need to be implemented? And how do we know that they have the right effect? Let's see if we can get this started. It needs charging too. I have one of these for my computer, if that's... or just transfer both of them. Alexa Lundberg is an actor, journalist, author, and lecturer. Perhaps one of Sweden's best-known transgender people. Hope this works. The slideshow came in PDF. I realized early on that something was wrong with me. I knew quite quickly that I wasn't a boy. At age 4, she felt like a girl. But the world saw her as a boy. So right about then, I started to see that it's not up to me what I am. How I want to be, want to dress, who I want to fall in love with. So that's just how it was. I had to wear boys' clothes and adapt to the role of a boy. But I couldn't handle it. I retreated to an inner world where I could be a princess called Aurora, and played by myself with my imaginary friends. So I was a very lonely child. At 18, Alexa turned to the healthcare system for sex reassignment. Her story of feeling like the opposite sex at a very early age, and struggling with the feeling of having been born in the wrong body. Gender dysphoria is shared by many transgender people. Transgender care exists for them, and the government is changing laws to make the process smoother and reduce their suffering. But in recent years, something has changed. The number of young people with gender dysphoria has skyrocketed. Many of them have several psychiatric diagnoses, as we said in our report last spring. This increase is occurring throughout the Western world, and there is little research about this new patient group. More and more experts are warning of the risks. Once they get here, they're already on the trans train, so to speak. Once you start on testosterone, you become a patient for life. You have to come to the hospital, take blood tests. It's a very serious treatment. We don't know how they'll be affected in the long run. There's no research. But we do it, and we hope and pray that it will benefit them and that they will be happy. There's an awful lot we don't know. That's what creates this, what we call an ethical stress, that we don't have satisfactory evidence for what we're doing. These are young people who are suffering from gender dysphoria and who are treated with hormones and surgical procedures. It's not just a medical issue, but also a highly political one. But do the young people who seek help get the right kind of help? The KID team in Stockholm treats a majority of transgender youths. My name is Louis Frissien, and I'm the head of the KID team, the team for gender identity evaluations in child and adolescent psychiatry. What is your perspective on the increase in gender dysphoria patients seeking help from you? I'm just as baffled as everyone else. We don't understand why it is. Everyone in the world who works with these patients wonders the same thing. I think it's likely that we're starting to see the iceberg. From only seeing the tip, now we see a majority of those with gender dysphoria. What's the risk if they don't get treatment? In the past, we said there was 100% risk of suicide among the people we called transsexual in those days. I don't think anyone thinks that today, but there is a real risk of suicide and other mental health problems. He's not excessively good-looking, my cousin who's staying with me. He'll be staying with me for maybe 6 months. You've developed so much as a person. It's absolutely huge. In your Casper area, you are Casper. Casper's the one who's developed so much. You were like the second person I told, and your reaction was legit. All you said was like, okay. Okay, I said okay. As far as I'm concerned, friends can't do much more than accept and try to support. Right, and it made me feel. Johanna is 19 and in her final year of high school. She's one of the young people who have sought gender-affirming care. She came out as Casper, but found herself in limbo when she sought help. At 17, she was too old for the KID team, but too young for ANOVA. She wanted to take testosterone and have a mastectomy, but had to wait a whole year before her assessment began. I had to wait a long time and went around like I got so frustrated with the wait. I just wanted to get started taking testosterone and having my evaluation. I had read online about transgenderism. I watched videos on YouTube. There's a community that I got involved in. Then I watched videos about how to know if you are trans. Just the fact that you're watching this says a lot, they said. Then I met a friend who is trans, and he described how happy he was. Since getting my mastectomy, life has just gotten better. I thought, can my life also get that good? What was so appealing? I'd hope I'd feel good in my body. I hoped it wouldn't be a struggle to feel good in my body. that the mastectomy would make me like my body, that testosterone would make me enjoy living in my body. Because I hadn't enjoyed living in my body. I have had since I was maybe 9 or 10. I've had problems with my body. Then I turned 15 and developed anorexia. And I started hating my body with a vengeance. I starved myself. I didn't think I deserved to eat or deserved to feel good. It became such a natural way of thinking to me. The wait to begin the assessment led to an unexpected consequence. The first time, I was proud to come out. The second time, it was an apology. I thought I was transgender because my body anxiety and masculine clothes, those two things together equaled transgender. What do you feel has changed now? Nothing on that plane. I'm trying to work on body acceptance is the word, but I still think. Before, I was firmly convinced that sex reassignment was the answer. Today, there are long queues to gender-affirming treatment. Transgender people have to wait months, even a year, for their initial visit. The wait can be tortuous. And this waiting time should not be confused with the assessment time. The assessment is a vital step. It determines whether the person is to be diagnosed and begin treatment. We have several psychologists and child psychiatrists and a secure method. We follow international guidelines. Thanks to parents who let us read their children's records, we saw that assessments can be very fast. In one case, it took 5 weeks from the initial visit until doctors decided to prescribe puberty blockers. Here at KID, how long does the assessment process take? From the initial meeting until a preliminary diagnosis is made. That depends on how simple or complex the case is. In the majority of cases, it takes 3 to 6 months. We've seen that it can take 5 weeks from the initial meeting to the preliminary diagnosis. I'd guess that those cases are younger children, where it isn't as difficult to make a preliminary diagnosis. Children that have clearly been the other sex since age 2 or 3, and in those cases it can go faster. In the cases we've seen, it was gender dysphoria that arose in the teens. One was 16, one was 15. One assessment was 5 weeks, one was just under 2 months, and about 5 consultations. That sounds very short for such a decision. It's hard to say why that is, but I guess they were cases that were very clear. But 5 weeks to a preliminary diagnosis? Is that still a careful assessment with a large number of visits? That depends on how many visits they squeezed in. You say 5 in 5 weeks? That sounds ambitious, squeezing in so many visits in such a short time. You don't think it sounds short? No. Because it all depends. It could be a person who is very easy to assess. And if they managed 5 visits in 5 weeks, they've managed a lot. You know each other and haven't lost touch between visits. So 5 weeks can be enough. Yes. At 16, I came out as gay, and I was gay for a year. Then I was 17 and met some trans girls at Pride Park. and I realized I could have sex reassignment and be a girl for real. Lesbians Don't Look Like That is the name of that chapter. I wondered, what are these hot girls doing in Pride Park? It's terrible, but even I had all those horrible prejudices. But that's what I thought then, so I went over and asked them, "What are you doing here?" And they handed me a flyer, and I looked at it. RFTS, the National Association for Transsexuals. And gradually I realized, aha, it's possible. I can become a girl. I was eager. I wanted to start my life. I wanted to go out and meet guys without worrying about what they'd say about what was between my legs. I wanted to start taking hormones. My assessor, who I call Sten in the book, he put on the brakes to a large extent and said, "This isn't a quick fix. It's not a rapid process. It's going to take time, and it's not guaranteed that you'll be approved for it. And it's not guaranteed that you'll be allowed." But that just turned my mindset even more to, this is for me. No one can get in the way of what I want. So it was sort of a war, as I recall, my whole assessment period. I tried to bare my soul completely, so as to not start lying or glossing things over. Gender dysphoria is a struggle. Many are in a hurry to get help. The first medical step for teens is often puberty blockers. They temporarily stop puberty, so the body doesn't continue developing into a woman or a man. The aim is to help the young person to feel better. Anna Olivikrona is an endocrinologist and chair of the Swedish Pediatric Society's endocrinology section. When puberty starts in boys and girls, it starts in the brain, which sends signals to the ovaries and testicles to start producing sex hormones. These hormones are then sent to various target organs and lead to the various things that happen during puberty. When I think of a young body that is meant to have tons of hormones and 1,000 things happening, that's how we're programmed. If we shut down that system, what consequences might that have? Actually, that isn't fully investigated. We don't fully know what happens. We know that the bones don't mineralize. You stop growing in height, and you stop the processes that would normally occur. The long-term effects haven't been studied enough, so we don't know.
Now, if the research has no scientifically valid basis and these harms are known, and there are so many unknowns related to fertility and reproductive potential, and they know that bone density is an ongoing issue, how is it possible that there is not a national inquiry into the referral of children for services like puberty blockers and cross-sex hormones?
This was the outcomes only after 1 year. And after 1 year on puberty blockers, there were a lot of things that the children got worse in several respects. So the most disturbing aspect of that was that the children reported a higher level of self-harm. And that, to me, raises a very big red flag.
International reports show that puberty blockers can make kids feel worse, that the risk of suicide increases. Last year, 351 people aged 12 to 19 were prescribed puberty blockers. What if the treatment doesn't always help, but has the opposite effect? Puberty blockers are the same drugs used for chemical castration of adults and for the treatment of prostate cancer. It's an important measure but a fundamental part of our treatment. That's what prevents the person from further developing, so they can pass for their desired or perceived gender. Aren't you subjecting them to a huge risk, taking hormones without knowing if they're right? As I see it, the risk is much greater if we don't treat them, if their bodies develop in a way they don't want. That's an irrevocable decision. Deciding that a child with clear gender dysphoria can't have puberty blockers. There, now I've done that. Can we go to the cafe? No, wait, it's closed. It will be open Monday. I knew what I wanted. The assessment was just a bump in the road. After that, I'd get testosterone, have a mastectomy, and be happy. Did you consider whether it was right for you if you'd really be happier? I didn't have the energy to think about that, because, not to begin with. I so wanted it to be true, I really did, that this was my path to happiness. So I thought, if I feel better after making the transition, then I can live and be happy. And if I don't feel better, then I'll kill myself. In December, Johanna finally got to visit the Anova clinic for adults. The only people I trusted to determine if I was trans was the Anova clinic. And their first question was, when do you want to start on testosterone? For me, all I want is for you to be happy. Then I might want to discuss how you feel and question some things. But the important thing was, how can I help you feel as good as possible? Let's see, I don't have anything to write on. I'm sitting here eating on the metro, so I've got my hands full. Hang on. Great, thanks. Thank you, bye. Final stop, all passengers disembark. They're building the railway, the train rails. So there's a gap between two stations where you have to walk. It's awful for me because I normally work and eat on the metro. Sten, my doctor, made it clear that the hormones would change my body. From the day I started taking them and another 6 months. He also made it clear that my life may be shortened by a few years. Trans women receive the female hormone estrogen, and trans men receive testosterone. Medication with cross-sex hormones is lifelong. It's a powerful treatment that affects the whole body. There's no definitive knowledge, but several studies link testosterone to cancer and increased risk of heart attack. We talked about the risks of treatment and the lack of research in our last report last spring, and several government agencies confirmed this. What do you say to the regretters who see your recommendations? The National Board of Health said this, but I wasn't mature enough to decide. The recommendations we've developed are based on the best knowledge that was available at the time. It isn't complete. We can't find a highest level of evidence for treatment. For example, we can't do randomly selected treatment or placebo treatment. The doctors who do this say that all this is thoroughly investigated. Is that not true? And other doctors say it isn't. Both groups refer to different types of facts. We want a compilation, in a systematic overview with a quality assessment of the facts. Hasn't that been done? No. In several parts of the world, research into transgender health is ongoing. An American team studied a large population. While the treatment boosts quality of life, the results for trans women are striking. 6 years after beginning estrogen, a greatly increased risk for blood clots and serious kinds of stroke arise. This is really interesting. Does this mean that even those of us who are okay, you're up here, the study ends after 10 years? How many years have, well, since I was 18, so almost 20 years. That's a sharp rise. But you didn't get information? No information about the risk? No, this is the first time I'm seeing this, so. I thought the graphs were striking because here it's primarily curves D and E, number of years after the first estrogen intake. I think they really shoot up. They really do. I haven't had time to look into how many there are and what the sources of error are, so I feel that you have to understand what the potential sources of error are. There may be an explanation. We hand over the report, published last summer, to Anna Oliver-Krona. It is the biggest study to date in the United States on transgender people. I absolutely think the results of this study are worrying in terms of the increased risk of thrombosis with estrogen treatment. Worrying in what way? It's a significant increase in risk after a relatively short treatment period. One of the known risks of estrogen treatment is a greater risk of blood clots. This is what worries us. This clearly shows a significant increase in risk. What does that mean for the treatment? We pediatric endocrinologists are and want to be cautious in treating young, growing people. It's very important to have detailed information before initiating treatment, to carefully weigh the positive effects against known and unknown risks. At the same time as doctors and authorities warn about the lack of data, parents who have said no to an assessment or hormone treatment have been reported to social services. A report of concern can lead to the child being taken into custody, and the Board of Health and Welfare support reports of concern. The KID team even has a pre-printed template for reports of concern. But the Karolinska Hospital website says that no treatments are begun without the approval of the child's guardian. That's an unfortunate phrase. In actual fact, we refuse to see any children without their guardian's approval. In rare individual cases, we may treat without guardian approval after contacting social services. But that's not what your website says. No. If we think that it's a matter of life or death to treat a person, so they will have the will to live, we can ask the Social Welfare Committee. I've promised to talk about treatment, so a young person can have the will to live. Many trans people have suicidal thoughts. For Alexa, her situation worsened after her gender-affirming operation. Although she'd finished her transition, some gender dysphoria remained. I've taken the final step. I can relax. No one can stop me anymore. And I was hit with all the feelings and all the thoughts I hadn't dared to think. What else can I do? Now I've done everything. That's it. I'm going to swallow a jar of pills and end it all. But I spat them out. I had them in my mouth, but I spat them out. It never turned into a suicide attempt, but it was the closest I came. Coming out as trans was my last hope. I recovered from anorexia, but I wasn't happy. I stopped self-harming, but it didn't make me happy. If this didn't work, nothing would. I'll try this, and if it doesn't work, then nothing works for me, and I might as well die. Whenever treatment is questioned, the suicide risk is brought up. A 2014 government inquiry found that young trans people take their lives while waiting for surgery. The inquiry proposed lowering the minimum age. Last year, the government presented a bill to permit, from the age of 15, the right to gender-affirming surgery without a guardian's approval. The Swedish Federation for LGBT Rights has worked hard to get this bill written. Trans people as a group have poorer mental health than the general public. There are many suicide attempts. We have plenty of figures on that. And if there are cases when it is judged likely that a person will be helped to have a good life through gender-affirming care, then they should be entitled to it without being hampered by the law. This is an extremely important issue, getting this legislation in place. There are transgender people who try to take their lives. One study shows that 40% of young trans people have tried. Those are terrifying numbers. This can be a matter of life and death. How many take their own lives while waiting to get to you? We have a very long queue. It's 18 months. And we don't go looking for people who disappear from patient records. But we would find out if somebody had died by suicide, if that person didn't appear, or from the referring psychiatric ward. So I've never heard of anyone who died while waiting to get here. The bill refers to the 2014 inquiry, which states in 5 places that young transgender people take their own lives while waiting for surgery, but there is no source given. Where does this data come from, and is it true? We talked to doctors and organizations that participated in the inquiry. Anders Rydelius built up Sweden's treatment for gender dysphoric youths. I'm not personally aware of any such cases. But you know that the inquiry also included special interest organizations, and that may be where the information came from, those organizations. I'd say it's more likely that some would have taken their own lives if they hadn't received gender-affirming treatment. Whether this was specifically linked to sex reassignment surgery isn't something I can answer. Do you remember where the data came from, the LGBT Federation? I really don't know. It might have come from them. The Federation tells us in an email that there are cases in which families said that a suicide was partly due to lack of treatment, but we can't find support for this in the inquiry. that young people take their own lives while waiting for surgery. So why is it in the report? The investigator, a professor of public law, refers us to the secretary, Teresa Bachmann. I can't answer that. I can't recall that it was linked to the surgical procedure. Because it does say in the section on the minimum age for surgery that young transgender people take their own lives while waiting for surgery. Yes? Why does it say that if you don't have evidence of it? I can't tell you what we wrote and why we used that phrasing. It should have said that young transgender people take their lives due to the conditions they live in. That's unfortunate. It's phrased incorrectly. This inquiry forms the basis of the bill. The bill is criticized by the Council on Legislation, which questions whether it is in the best interests of the child. The bill says the surgery should only be done for extraordinary reasons. The major hospitals say no, there is no scientific basis for sex reassignment surgery on young people. It could increase their suffering. But some authorities are positive to it. The Public Health Agency's job is to monitor public health and living conditions and determine factors for health, and to strive for more equal health throughout the country. We look to the Convention on the Rights of the Child and the right to respect. So you interpret the rights of the child as meaning that it's important that children from age 15 can decide to have genital surgery? They should at least be able to have a say in their own care and treatment. Do you have any evidence that the surgery helps them? Any data? No, it's nothing that we've investigated. Johanna had to wait a year to get into the Inova clinic. At her first visit, the doctor brought up testosterone. Inova emphasizes that no medical treatment begins before diagnosis. Johanna later dropped out of the assessment. While she waited, she began seeing a psychologist. He told me, because I've had difficult body-related experiences, I've had an eating disorder and a problematic relationship with my body. And he said, what if it isn't being trans that caused your anorexia? Because that's what I told myself. I got anorexia because I'm trans. But he made me turn it around. What if I say that I'm trans because I still have residual body dysmorphia from the anorexia? I was looking at it backwards. It was an eye-opener for me. After our previous program, there was debate as to whether the science supports irreversible interventions on young people. 2 women who regretted their sex reassignment told us,
nothing can be done about my body anymore because the surgeries and everything, they are irreversible. My voice is always going to sound like this. I will not get my breasts back. I will not get my, the stuff back. Nothing can be done.
We are one giant experiment. We're guinea pigs, something that there's no science to back up. Where in the medical field do you do that? Where do you gamble with the people's lives like this? Should everyone who turns to doctors get gender-affirming treatment? What caused the massive increase in patients? Some say that society has become more accepting. or because the sterilization requirement was eliminated. At the same time, there's a similar increase of young people in Finland, where sterilization is still a requirement. Gender dysphoria off the rails is the name of this symposium. Some doctors believe that young people are treated for gender dysphoria when they actually need other help. We need treatment in which transgender people who need gender-affirming treatment and are helped by it can have access to that treatment as easily as possible. When gender affirmation treatment for youths was set up in Västergötland, Angela Samfjord was a driving force. Transgender care is important to her. Yet she chose to leave her position. She met patients with major psychiatric comorbidity, where the risk of incorrect treatment was great. It preyed on her conscience. There is a very clear predominance of the female sex, up to 85%, with high psychiatric comorbidity. 90% have some psychiatric diagnosis. 80% have 2 or more psychiatric diagnoses. 45% are self-harming. 20% have an autism diagnosis. But another 35% had so many symptoms that we wanted to refer them for a full evaluation. When I realized the complexity, I realized that healthcare professionals, despite this, are still expected to okay gender-affirming treatment, despite the lack of evidence that we actually currently have. It preyed on my conscience, and I wasn't prepared to take the risk as a doctor of causing these patients harm. I took the consequence of that and resigned. We also need healthcare that catches the individuals who are not helped by gender-affirming treatment and make sure that they don't get it. Is that not the case today? Karolinska in Stockholm makes it clear that not all patients get treatment. The website states that of the children who started assessments last year, only 1 in 3 met the criteria. What happened to the other 70% who started an assessment? They turned 18 before we completed their assessment. So they were referred to the adult clinic, ANOVA. So it wasn't the case that they didn't meet the diagnosis criteria? Most of them were just referred? Yes. Most of them come here around age 17. Why didn't you write that then? I interpret this sentence as meaning that you only diagnose a third of them, that the others didn't have gender dysphoria in your assessment. I think most people interpret it this way. I agree that it's an unfortunate turn of phrase. Has it happened that you've said, "We don't think you're transgender"? Not in such certain terms, more like a discussion with the patient. Healthcare professionals should be the impartial ones, who dare to say, "You're trans" or "You're not trans." The role of healthcare professionals is to diagnose, not to be nice. The first person I told that I couldn't identify as trans anymore was my psychologist, and I cried and I cried, and I said, "I don't think I can call myself a man anymore." And I cried out of grief. It was so tragic to realize that this wasn't my quick fix. This wasn't the solution for me, probably, as it looks now. And I so wanted it to be. I so wanted this to be my happy ending. And coming to that realization hurt so much. What are the thoughts that come up? That's it. Did I need to have this operation? I have no idea, but I do have that thought sometimes. With everything I know today, couldn't I have lived as a feminine, as a gay guy? That kind of thought. I would have been exactly the same person I am now. I would still be that. I wouldn't have been a different person. But could I have lived in that body? Or would gender dysphoria devour me? I don't know. The Riksdag debates the reply from Social Minister Lena Hallengren on interpellation number 308 on legislation regarding gender dysphoria. In Sweden, you have to be 18 to get a driver's license. To buy alcohol, you need to be 20. If you want to get sterilized, you have to wait until you're 25. That 25-year age minimum is because the brain isn't fully developed until then, so you can't fathom the consequences. If there are flaws in our system that lead to young people taking their own lives, and they have gender dysphoria, I'm not qualified to determine treatment. To allow 15-year-olds to choose sex reassignment surgery without permission of a guardian is the proposed bill to help young trans people keep the will to live. There are trans people who consider taking their own lives. There's a study that shows that 40% of these young people have attempted it. Those are terrifying numbers. This can be a matter of life and death. The public debate repeatedly refers to the Public Health Agency's 2015 report, in which 40% of young transgender people said they had attempted suicide. It's a very high number. Danuta Wasserman is a professor in psychiatry and suicidality, and a global expert on suicide. I have difficulty believing that 40% have attempted suicide. In the international surveys, 30% had suicidal thoughts. In the younger age group, 15 to 19, 40% said they'd attempted suicide. So we can't assume that's true? No, we can't. In the scientific world, we say that if you get surprising results, the first thing you do is to verify that they're really correct, that there's no error in method, in interpretation, or that the study population isn't highly unusual. There are very many pitfalls in this type of survey. So, based on this survey, do you believe that 40% of young trans people have attempted suicide? No. The Public Health Agency itself wants to tone down its own importance. It's important to apply caution when interpreting these results. The study is a cross-sectional self-report study. It's not randomized or verifiable. 40%, I don't think is... But based on your study, the conclusion is that 40% of young transgender people have attempted suicide. We can draw the conclusion that a large proportion of transgender people are troubled, have suicidal thoughts, and many have attempted suicide. What does it mean if a minister argues for change in legislation based on unconfirmed, uncertain figures? Among young transgender people, 40% have attempted suicide. 40%. It's almost unbelievable. And does it matter when it's a group we know have mental health issues? The Minister for Gender Equality declined an interview. What knowledge do we really have about what is beneficial? What can be done to improve their mental health? Several initiatives in different arenas: schools, social services, society, reduced discrimination, good care in the healthcare system, and thorough assessment and treatment based on the individual's needs. Is there anything in this report that even hints that sex reassignment surgery from 15 years of age would reduce the number of suicides? No, we didn't look at that at all. Does anything indicate it? No, we haven't conducted any such analysis. The Public Health Agency's study and the government inquiry are both used to argue in favor of the bill. The risk of suicide, both those who consider it and those who do it. The risk is much higher in this group than generally in society. That's common knowledge. No one questions that. Then we can discuss to what degree this reduces the risk of suicide. And are the right individuals getting the diagnosis? But the bill is based on the idea of preventing suicide among young people if they don't get sex reassignment surgery. Yes, that's one reason, but at the core, my approach has been that healthcare professionals should have the tools they need to care for all, no matter what their needs are. It says, there are examples of young people taking their lives while awaiting surgical procedures. If this isn't factual, isn't that important to find out? I can't tell you if this is factual or not. I assume that the documentation I get is correct. The investigators say it's poorly worded, but I trust the investigators. I can't act any other way. I can't tell someone to investigate and give me a report if I'm going to question every comma. However, there are referral bodies who have a say. Yes, how can a minister know that a report has poor phrasing and incorrect data? The consequences can be that measures are introduced that don't help an already vulnerable group. People are always advised to avoid making life-changing decisions when they are depressed, anxious, or grieving. And why would we recommend anything else in this situation? When we know that many trans people have anxiety and deep depression, what help do they need? The evidence clearly shows in suicide prevention that we need conversational therapy for young people before, during, and after puberty. And there are many evidence-based treatments. I ought to tidy my office first. I don't know how it looks. After our previous program, Christian Democrat Mikael Oscarsson began asking questions about the bill. The government is now taking it up again and asked the Board of Health and Welfare to review the bill. A month ago, the Minister for Gender Equality said the government would enact the bill. But now they're requesting a new review, and changes came in now the day before the debate. The referral comments on the bill came in a year ago. Reacting now, the day before the debate, is quite bizarre. The National Board of Health and Welfare is to look particularly at age. Is it right to lower the minimum age to 15 or not? Do you know what their response was last time? They supported the proposal, as did the Public Health Agency and others. How objective can a new evaluation be if they've already said yes? Now they're to look specifically at age, and they'll have time to analyze it. If the bill is enacted, what does the Swedish Pediatric Society think? We don't think it's appropriate. We think we need to be careful with young bodies and let the natural processes occur as much as possible, and allow the individuals time to consider and seek their identity. And when they're sure, then help should be available. When I wanted to come out as a girl again, I was very close to killing myself. I thought, I can't stand that everyone knows I was wrong. So many times I felt I couldn't bear that burden. I couldn't say I was wrong to the extent that I was. It was the shame of it that scared me the most. It felt strange to be called a girl and Johanna. But I thought that I have to try. I still feel like that. Right now I'm okay, but I can still change my mind. I think that's my salvation in this. That I don't have to have a permanent answer, like when I came out as trans. When I came out as a guy, it was like for eternity or not at all. Now I feel this is how I feel now, and I don't have to decide more than that.